Canada's man in motion, Rick Hansen, has been building a dream for over 20 years to make communities more accessible and inclusive for people with spinal cord injury and support research towards a cure. Last year, Prime Minister Stephen Harper provided the Rick Hansen Foundation with $30 million to help create a national spinal cord injury translational research network. The first program of its type in Canada, the SCI-TRN's mission is to reduce disability, maximize ability, and improve the quality of life for people living with a spinal cord injury. The network is gaining momentum nationally, having already established registry sites in provinces across the country. Dr. Marcel Dvorak is head of the Spinal Cord Division at Vancouver General Hospital and head of SCI-TRN's registry.
It's very exciting because for the first time ever, we're able to pull together patients from across Canada and actually ask them how they're doing after the treatments that we provide. And we think that this is going to lead to dramatic improvements in outcomes for these individuals and eventually better quality of life for people with spinal cord injuries.
Today, Premier Dalton McGuinty announced $10 million in support of this national initiative to help benefit people living with a spinal cord injury in Ontario.
We want to do more to ensure that we are collaborating and drawing upon the very best practices. We want to do more to translate the best information, the best knowledge, the latest discoveries into frontline practices so that patients have greater access to better treatment options at an earlier point in time.
Through advancements in research over the past 20 years, people with spinal cord injuries are already seeing benefits. Dr. Michael Failings is lead of the Acute Care and Treatment Practice Network for the SCI-TRN and medical director of the Krembil Science Centre. He also heads the spinal program at Toronto Western Hospital.
When you consider an individual like Bruce Brady, who, when I met him, was quadriplegic from a skiing accident, and to actually see someone being able to walk away from an injury and to be able to put that into human terms, it really validates what we are trying to do.
Before the $10 million was given, there was research available to help me, and my story is amazing. So what's the next story going to be? Maybe a lot more amazing, a lot more incredible.
This moment takes us to the point where we are no longer individuals working on this quest. We are a united team, and we are stronger. We are stronger than the sum of our parts, because with a team, anything's possible. And thank you for being part of this incredible enthusiasm and infusion. I really appreciate it. Thank you.